All right, so let's proceed now. Good afternoon. I'm very sorry that I have to spend so much time to set up all this gadget. This is actually the problem that we have. Now, in the university, in our college, we have not started yet. For 2 weeks, we're going to have blended learning like this, up. But for now, fully online for 2 weeks. So I think last Monday I started with the lecture, and at the same time, it's so strange, no? It's so difficult because I have to stand. Normally I have to walk around, all right? But on the other side, you will not see me. So as I was telling you, no, psychology is very important in psychology because it will help you understand yourself and your patient, no? So along that line, we will be understanding so many concepts as I introduced last meeting to you. We will be discussing about theories of personality, emotions, motivations, fears, dental pain, among others. Okay, so I will continue now. I think we start here. Okay, in dental fears, right? So you see, when you're going to be a dentist, the reason why you are coming here is just because you would like to become doctors someday. In a matter of time, maybe 4 or 5 years from now, you are going to practice the dental profession, right? Now, you're not just coming here just because you would like to pull or operate on the teeth of your patients. You're going to connect with your patients by all means. That's the real deal. You're going to become professionals. You're going to deal with other people. You're going to communicate with other people. The challenge is, how are you going to deal with them? Right now, there is difficulty dealing with other people. Maybe you could have enemies. Why is it that you are maintaining enemies? Because you do not understand one another. At home also, it's difficult to understand your parents, maybe your brothers or sisters. So this is exactly the point why we need psychology in your curriculum. Now, along that line, I mentioned to you about communication skills and rapport building. When you're going to practice your profession, you're going to deal with people. Now, dealing with people is easy for the first time. Maintaining other people so that they will come to you is a challenge. This is your job supposed to be, isn't it? You would like that people will come to you. I think last example I mentioned to you last time was about, let's say when you're going to basic doctor clinic, no, a doctor's clinic. When you go to the doctor's clinic, most of the time they will ask you to come back, right? Why is it that they will ask you to come back? There are two things. Number one, to follow up. Number two, money, isn't it? So they ask you to come back after 10 days. Why not 7 days? You notice that?
Yes, because of the
Yes,
insurance.
I mentioned last time, 7 days, insurance free, right? Because that's a follow-up. Now you have known the technique already of going back to the clinic or to the doctor's appointment and so on. Within 1 week, you should go back because you will be free, especially if you're actually paying co-payment in your insurance, no? If you're free, no problem. If your insurance is actually shouldering 100% of the payment, then you can come back anytime. But if you are paying additional money because your insurance not paying all, then you have to understand that the hospital, the clinic that you have visited will actually ask you to come back for 10 days for money, no? And of course, to follow you up, right? After that, you have to pay. So the same thing is true when you're going to practice your profession. Rapport. Patients will come back to you. Dental practice is quite difficult and challenging also because you're going to see your patients only once in 6 months. But the thing is, if you're a very good doctor, you have a rapport with your patient, the advertisement is actually coming from them. They will tell other people that you are a good doctor. You are easy, you can easily be talked with. You can easily, you are a nice person to talk with. You are a nice person to deal with. So they will come to you. People will come to you. That is the meaning of establishing rapport. So maybe When you are going to tell them you come back after 6 months, they will not come back after 6 months. Maybe they'll come back in 1 month or 2 months' time. Just because they like you, just because they love you, just because you built already a rapport with them, isn't it? You become friends with them. That is the reason why so many clinics are thriving just because of that. Because you are going to survive the competition. There are so many dentists around. You are going to maintain your patients, the number of patients that you may actually have. So it's very important that you're going to establish your communication skills and rapport building. It's emotional connection in short. You're going to show that you understand your patient. You're going to show that you understand your anxiety. You're going to show that you are careful in dealing with them. Particularly, when you're going to deal with anxiety and fear and pain, it's difficult, isn't it? So the patients will always be assured that you are there to help them. Other than that, you're going to deal with dental fears, particularly children, right? You will be surprised when you're going to practice your profession that there are people who are coming to you, yet they have not seen a dentist for more than 10 years or in their lifetime. Have you noticed that? You see, when was the last time you have seen your dentist anyway? Except here, there are so many dentists here. Your personal dentist, when was the last time you have seen them?
Yes, before 2 weeks.
2 weeks, very good. What about others? Dentist, no? When was the last time you visited your dentist? Last month. Maybe others, some of you here, maybe last year. Maybe not at all, because you don't have any dentist, right? Things like that, no? Just because others are afraid to see a dentist, because they would always associate dentist as if there is pain. Because when the patient come to you, most of the complaint that they would actually have would be toothache, complaint on their mouth or on their teeth. So they would always look at the dentist as if the dentists are always associated with pain, so they are afraid. Children much more, isn't it? So you're going to deal with them. Some of you will become pediatric dentists here or general dentists. So by all means, your patients who are afraid. How are you going to deal with that? How are you going to alleviate the fear of your patients? So we're going to look at that as we go on with our discussions in psychology. Understand? We're going to look at emotions as such. All right. So moving forward, we are going to deal with pain. You have to know that pain could actually be acute and chronic. What is the meaning of acute and chronic pain? Now, acute pain is pain that comes all along, right? It's just like there, no? Appearing suddenly, as if there is no, as if by magic there is pain now. And usually, if it appears like that, it will really be painful and severe. You would curse everyone, no? You do not, you want to die as if, no? When you are going to have acute pain like that, it's very painful, no? You would exchange everything, right? So that your pain will just actually be removed. So that's the thing, you have to understand that. Patients will come to you just because of that. The most painful experience that you could have would be toothache, number one. Number two, stomach ache. Number three, headache. See, these are all associated with pain, right? You have to know how to deal with your patients, no? All right, moving forward. So chronic pain, that chronic pain is actually as a result of some problems in your oral cavities, Once in a while, just because you are not brushing your teeth, pain appears. But this pain would also disappear, right, without treatment at all. So that's the reason why patients will not actually see you most often, just because of chronic pain. Huh? All right. Panadol, little bit of Panadol, one capsule of Panadol, one tablet of Panadol will be okay, right? But before they know it, it becomes worse because all the aspects of your oral cavities will be affected, like your temporomandibular, your temporomandibular regions, and at the same time your nerves. All right. And of course, you're going to deal with oral parafunctional behaviors. Patients will be asking you, why is it that they are cringing? Hmm? Why is it that they are actually having what we call as bruxism or grinding of teeth? You see, you will be able to explain that because these are all behavioral in nature. You see, sometimes actually at night time you could hear some people grinding their teeth, and it's very annoying. Have you ever experienced that in your family? No, usually when your family members would actually be dreaming they are grinding their teeth, and it's very annoying. It's very noisy. No, all right. So how are you going to deal with that? You cannot just pull out all the teeth in order to solve the problem. Most of the time, it will be psychological, and we have to know how to deal with that eventually. All right? So we're going to teach you how to do that. Anyway, moving forward. Uh, Special needs population, aesthetic dentistry. We're going to deal with people who are mentally challenged. They do not know how to brush their teeth. They do not know how to do oral care. So definitely, they have bad teeth. They will develop bad teeth. How they are going to view themselves. Most of the time, a lot of people are actually giving premium to their teeth because once that they have a beautiful teeth, they equate that with beauty, isn't it? Other people would do something so that they can actually manipulate the teeth. They are going to have what we call as how do you call it? The wires here, the braces, because they think that having braces would actually increase their beauty or handsome factor, isn't it? Or what about the mentally challenged, where they could not actually take care of their teeth? All right, we're going to look at that. Chronically ill, and then at the same time, geriatric patients, old people. Old patients. Old patients, if you're going to look at their teeth, maybe they're lucky if they have. If they have, maybe the teeth are actually problematic already. They could have infections, they could have tooth decay, it's already brown, it's pulling apart. So we're going to look at themselves. We're going to actually assist them on how to look at themselves. They are incomplete in any way, isn't it? There is already psychological factor. Their self-esteem may be affected, isn't it? When you think that you are inadequate, your self-esteem will be affected. Right or wrong? That's the reason why they're closing their mouth. They do not want to communicate with other people anymore. They do not want to go out anymore because they feel that they are not beautiful or handsome. They feel that they are inadequate. Their self-esteem is low. So we are going to help them in any way, right? One of our job also is not just the practice of dentistry. We're going to have health education also, isn't it? We go to the parkland areas to teach about, let's say, dental care, among others. All right? Then, of course, in public health, the community interventions, how we are going to assist our health care members in the community so that specifically we're going to look into oral care. The most neglected part of our elderly and young people would be oral care, right? So we could actually assess the public health services in order to make it sure that these people will actually practice proper oral care. Just like what we are doing right now, all majority of the health team members are involved in vaccination. You see, we are actually helping also. That's one way. Of course, oral problems would be another. Right now, we are focusing on COVID-19, but there will be a time that we are going to focus on this. We do not know this because sometimes these are not reported because these are not so serious problem, isn't it? But whether you like it or not, this is actually happening in our community. This problem is happening in our community. people do not actually see dentists most of the time regularly. So how are we going to make them see you regularly, right? How are we going to ask them to see you regularly? So we're going to pass through health education. We're going to cooperate with the public health team so that we can actually teach these people to trust you once more. Moving forward, no? The quality of life, you see? I think you will be involved with this. There will be abnormalities like what you actually are seeing there, no? Definitely, if you're going to have a clip palate baby like that, you think that baby will have a very good quality. They cannot eat properly. If they are incomprehensible, you cannot talk to them properly and you cannot understand them properly. So exactly, this is the main point. Some of the doctors actually from United States and European countries are performing surgery in order to alleviate clip. Actually, we have programs like that. So we are going to increase the quality of life of the population also. No, then aesthetic dentistry is one point. You know, in psychology, we have what we call aesthetic psychology, psychology of beauty. Now, because people would always appreciate the beautiful, not our faces, but everything around us. In similar way, we are going to look at ourselves as if we are handsome and beautiful, looking on our hair, and at the same time, based on our oral health or dental health. No? So, as I mentioned earlier, you're going to spend so much time making your teeth white. Yeah? How many hours you are spending in front of the mirror yourselves? Yeah, right now it's okay because you could hide everything, no? Just because of the mask, right? People are spending in front of the mirror every day, at least around 30 minutes on the average, fixing themselves, brushing their teeth. Yeah, I know that because who is spending inside the toilet for 1 hour. He's like you, no? Than you know, yeah, to what you are doing there. But if you're going to have time, maybe there are so many beauty regimen that you are actually doing, cleaning your body, brushing your teeth, among others. Yeah, you do that, isn't it? All right. Then of course, crown, something like, you know, and of course, reconstruction. No, you really would like to appear so beautiful. Your teeth is something else. No, all right. You really would like to have a beautiful teeth so that people to you also a plus factor, additional factor. No, you're in love with people who are smiling. No, you love them because they smile a lot. You love them because you admire them because of their teeth. So people would like to have like that, isn't it? So that could be one that we can actually have in aesthetic dentistry. If we have aesthetic dermatology, you know, plastic surgery, we have also aesthetic dentistry, no? And they really would like to manipulate so that they would actually appear beautiful. When they would appear beautiful, they increase their self-esteem, the way they buy themselves and the way they look at themselves. All right? So we're going to look at that. All right. And of course, these are the psychology skills useful for you as dental students. Of course, communication. Now, believe me, there are students who are very good, but they do not know how to communicate. Either they are shy, or either they are afraid, or either they are not sure of themselves, right? This is actually related to the experiences that you have in the past, because you allow your parents always to control your life. You cannot even speak, you cannot even decide on anything, but you are good. The problem is you cannot speak, you cannot communicate. because you always see other people as if they are your parents. So in front of them, you are, you get the point? Isn't it that time sometimes you feel so shy? Why is it that you feel so shy? Because you always think that you could be associated with someone else. So we are going to look at that so that eventually you could always try to change, improve yourselves. All right? So anyway, communication is one. Next one, of course, fear and anxiety management. We will manage the patient's fear, but much more, we will manage our fear. This is a reality. I am a psychologist, but don't you know, I'm also afraid once in a while. Yeah? That's why I'm a doctor, but I need to see a doctor. See? You could not manage everything. Don't tell me that when you are going to be a dentist, to treat yourselves. Will you do that? Are you going to go in front of the mirror and pull your teeth out like this? Of course not. Like us. We cannot manage our fear once in a while. So we need other people to understand us also. You manage the fear, and at the same time, you are going to find time and a way to manage your fear also. There are so many. Fear, fear of the reality, fear of the impending danger, among others, right? And of course, management of the patient. This you can actually see, especially when you're going to practice as a pediatric dentist, or you're going to become a general dentist, no? People will come to you. Imagine you're just going to pull out the teeth of your patient, then the patient will cry. You injected already the anesthesia, then the patient does not want anymore. The patient will run away. What are you going to do? Isn't it? Calm. But how are you going to do that when the patient is very disruptive already? You have a small clinic, patients are waiting, and you're a single person in the clinic. Of course, you have nurses and other helpers, but you are the only dentist there. 5 are waiting under electric patient who is very disruptive, who is about to destroy everything in the clinic. So what are you going to do? Are you just going to send? It's unethical, isn't it? You're going to patient at all costs, across all ages, across ages. So what are you going to do? You're going to learn techniques in order to make it sure that you can manage this. All right? So many things. Patient intervention to enhance self-care. It's not just we are going to tell them that they're going to brush their teeth. We're doing health education. You see, honestly, I have seen my dentist last year, but there was no follow-up. How is that? You see, if the could have followed up on me, maybe they could have called me, then I would appreciate it, right? So that's the technique that you're going to maintain. You're going to maintain connection with your patient all the time. It's not just one time, big time. Don't do that, or else your clinic will actually die. One time, big time, you treat the patient, they will not come and see you again. How are you going to maintain them? Call. Isn't it? Once in a while, this is the thing. So you try to make it sure that your patients will actually do what they need to do. If you call them for free, you do not charge them, but you are actually making it sure that they manage their oral care properly. Particularly when you have seen children who have undergone surgery, or maybe patients who have undergone surgery, you could actually follow up for free. You may call them. That's your job. After all, following up and maintaining with your patient will actually make it sure that they are going to alter their behavior eventually. It will become a habit all the time. See? You ask them to brush their teeth 3 times a day. But when you call, maybe they have forgotten to brush their teeth, or maybe they have brushed their teeth once. So it's a sort of reminder, reminding them will maintain their practice. Once that the practice is there, it becomes a habit. It becomes a part of their themselves. No? All right. In that case, they can maintain their oral care by themselves. So this is exactly why we are here, to do that. And of course, we are going to engage some motivational interviewing, particularly those people with oral problems that could have affected their self-esteem, critic dentistry. And of course, among others, we have the pain management. People will come to you just because of pain. Trust me. You see, that's the first thing. When you're going to practice, that's the first thing that they are going to do. Dental pain, they will come to you 100%. One time, big time. So it's your duty to follow them up. Then that will be good. All right. So moving forward, you are going to do what we call as the practice of ergonomics. In psychology, this is actually inventing or developing utensils or equipment that could actually be easy to use. As dentists, you will learn how to manipulate your dental equipment nicely, properly. You see, people will compare your hands. Sometimes they are going to tell you your hand is easy, so I didn't feel anything, or your hand is something like not so easy, Sometimes they do not want to come to you anymore. Your hand is so hard, something like you are not at ease in manipulating the equipment. So patients are coming to you expecting that they would actually have comfort. See? So it's your duty to make it sure that you will learn how to manipulate and use the equipment that you have skillfully. It becomes a habit. We are going to have that in psychology, And you are going to train yourselves how to do that. It becomes a habit, then it becomes a part of you. Just like what we are doing right now. I'm a nurse also, As nurses, we will take blood pressure. We close our eyes. We know your blood pressure. We can still take your blood. Because we are doing that every day. Isn't it? Just because routinely we are actually doing that every day. Otherwise, when you are going to become a dentist, you will learn how to skillfully utilize the utensils that you may actually have. These are the functions that we have in ergonomics. All right? Psychology of ergonomics. Okay? Moving forward, we are going to look into your curriculum also. Many times that your curriculum have been revised. As I mentioned to you earlier, I think last meeting, I mentioned to you that you are very different. You are here because you are special. You believe that? Because not all can actually attend the College of Dental Science, isn't it? One, it is expensive. Two, there is admission criteria. So it follows, isn't it? The admission criteria actually looks after your capacity to become successful. That's the reason why we are actually giving the criteria. If you have not met this criteria, maybe we'll actually give you conditional admission. And there are people who do have conditional admission to look if they can actually make it or not. You are special. Then you're paying so much. Now, on the average, 85,000. 85,000. If your parents are not actually having job or not working, with their blood, and isn't it? And you see, sometimes I see students who are not doing good. I always tell them, you think about your parents who are actually making so much money for nothing. Come on, you have to study. So that's the thing. No? So curriculum in universities, particularly here, would always be technical oriented after third year or fourth year, you will see. No, most of the time they're going to teach how to utilize this utensil. As of now, basic education, we would like to improve the way you are thinking, the way you are behaving. Because we would like to change your mindset. You know, it's very difficult to teach a student to actually become professional in specific field because we are molding them. We try to mold you. As of now, most probably when you came here, you do not know about dentistry. Here, you try to fit in. And that's the difficulty that we have as a part of this university. We try to mold you in so that in. So eventually, after releasing you here, you're going to think like a dentist, act like a dentist, and work like a dentist. That can happen after most of the time you're going to think like a dentist already because there is already an effect of the way that we are here. We're trying to shape your thinking process. As of now, I think Dr. Joan is teaching about anatomy and physiology. So we are actually teaching you, Dr. Joan is teaching you about understanding your basic. Anatomy means the basic parts of your body. Then Dr. Joma is talking about oral, no? You are having oral anatomy as of now? Dr. Joma? Teaching oral, all right. You see, actually, Dr. Joma is a killer all the time together with me. You know, so many are failures, but so many are failing, but we are actually giving chances to the students. No? All right. So I never knew that. No? Thanks for the news. Anyway, actually, he could have gone somewhere else, no? All right. So now the problem is, some of you could actually have been thinking that psychology is not scientific enough or is not practical enough. I'm telling you, you see, psychology is actually very important. We keep on improving. Dentistry needs to improve. All sciences to improve, right or wrong. New discoveries are actually happening every day. That's the reason why psychology also keeps on improving. You see, there are so many branches of psychology. The latest that we have in psychology is actually the science of psychology of LGBT, the third gender. You know, in the United States, there is a third gender, but of course, not that here because it's not allowed, right? I don't believe in that, but still psychology, you know, there are psychologists who are really or believing on LGBT community, you know, so mindset of those people, right? There are so many branches of psychology. We keep on improving psychology also. And this improvement is scientific enough so that this becomes a science and this can be applicable to our life. It will be also more practical. That's why I enjoy psychology, you know. It's practical enough to help me understand myself also and understand. All right? So moving forward, these are some of the institutional challenges that we have, okay, offsite, not belonging so much here like in dental. Now in the university, there are only 2 psychologists. Now university, you know, and Carol. Carol is, I think, having her PhD already on track. I have already 2 PhDs for psychology. The 2 of us are sharing, no? And the 2 of us actually are trying to help people, but they do not want to see us, no? As if, you know, we have disease, no? When people come to us, it looks like they have problems already. We are different from psychiatrists, no? Psychiatrist there, Dr. Talat, but his practice is different from our practice. You see? So let's choose issues faced by dental students particularly. So I know I'm a teacher, I'm a nurse, I am a psychologist, I teach psychology to dental students, so I know what is actually running into your head, right? From the beginning, okay? And other than that, especially because I have a son whose age is like you, so I understand truly who you are and what you are, yeah? Isn't it? When you really would like you intend to do things, you are going to put your heart in it. But if you don't like that thing, kaliwali, you will not put any effort at all. Yeah? Okay. So, and of course, the curricular time that we're spending here, 2.5 hours, 3 hours per week is actually enough. No, general psychology as such. This is not special. So supposed to be all curriculum, all degrees, all courses may actually have psychology. No, because we really would like people to improve themselves. The idea that when they go to the university and study a particular profession, they are going to focus their attention only on a particular profession. You start immediately with the different dental curriculum, the major subject. I think that will not be good. Yeah, the thing that you're going to do is actually to improve yourselves first. Try to be patient. No, eventually you will actually be seeing patients already. I think when you will be in third year or fourth year, no, you will start seeing your patient. Yeah, try to be patient. No, try to improve yourselves first. That's good and for your own benefit and for the benefit of your patient also. You have to look at that way. All right. Uh, Solutions of so many issues that we are actually encountering right now. Collaborative relationships would actually be very essential. Right. Sometimes we communicate with the university, we communicate with the college, we communicate with the other teachers. I always communicate with Dr. Because we always talk about the problems that you have, no? As sort, he was one of my contact here, so we will communicate with that. No, we went over the problem of our dental students, especially dental students who are very careless. They don't care about education. No, they come to school, they just actually say present, they go home. At the end of the semester, they would show to their parents all F. No, there are so many repeaters like that. No, I do hope that in this batch, no one will do that. No, I do hope that you are going to put your heart and mind in the study of dentistry, whatever the courses will be. Dr. Homa is teaching you English. Please try to pass, you see, among others, because this will help you also eventually, no, to improve yourselves as a person. And then other than that, teach the teacher. Most of your teachers are not teachers. You get it? Sometimes they do, right or wrong. Imagine after graduation when you're PhD, they already ask you to teach. What will I teach? How do I teach? How do I deal with my students? See? So sometimes they are actually engaged in seminar. They try to learn some fundamentals of teaching and learning. So in that case, they also learn how to teach properly and how to manage a class. It's very difficult. You see, imagine after this, most probably you are very good because there are so many students who are actually very good in dental science, in dental college, no? You will be admitted. Some of your teachers were my students, don't you know? And I can actually assure you that when they were under me, see, they will actually ask you to teach. Now, what will you do? You need a job. So you will teach. How will you teach? So we collaborate, no? We teach the teachers also in any way. But of course, in high school, it will be different because they went to a teaching school, isn't it? Or a teacher school. They are taught the fundamentals of education and teaching, so they know how to deal with students. But in specialty schools, including psychologists, we don't have fundamentals, so we are helping one another. All right? So that's the thing. We have to collaborate. Like we are doing observational modeling, we do some sort of seminar and conferences, among others. No? And of course, another thing that we are actually going to do as teachers would be preparing for the future. the system-based curriculum that we may actually have. It is multidisciplinary. Whether you like it or not, you're going to be using multidisciplinary approach, isn't it? There are teachers coming from medical college. There are teachers coming from general education. There are teachers coming from my department. And there are teachers coming from outside. There are teachers that are embedded in this university. It's a collaborative approach, right? It's a multidisciplinary approach. You're very lucky, no? Because the university is taking care of your needs. It's necessary. And the most wonderful thing that's actually happening in this institution is that your teachers are also multinational. You know, I'm a Filipino, others are Indians, and among others, okay? So we are going to learn from each other also. I have to admit that when I came here first 10 years ago, I got difficulty teaching. Particularly, it's very difficult students like you, especially Muslim, no? Because in the Philippines, I can say anything I want. I can say anything I want. I can joke anything I joke. But here, I have to tone down, no? You get it? And there are words that I cannot say. Sometimes a little bit of, let's say, adjustment. I don't have to do that, no? And then, of course, it will be integrated. So after your curriculum, you will be full, you will be holistic, you will be complete. You will not just be a dentist, but you are going to become a very good dentist and a very good person. This is what we would like to have. We do not want only to develop a dentist out of you. We would like to develop a very good citizen, a very good person. Whether you like it or not, you're going to get married, isn't it? How are you going to get your family? Now, the approach that we have in psychology is just like that. We're going to study the stages of human development so that you understand how to raise children. You will understand yourselves. The first lecture that I gave you was about this last time. No? I mentioned about understanding the most confused generation, stage of your generation is your generation. You do not know what you want. You do not like, isn't it? Because generally you are belonging to 1920 on that particular age group, right? Anybody who has who is 21 or more here? Maybe you're more mature. Others are a little bit
Me
confused.
too. I am 25.
Oh, 25. Good.
No,
You
no,
are
I'm
mature.
joking. I'm joking.
Yeah. And then, of course, comprehensive. We actually focus like that, no?
Doctor, do you think that
Yes.
age
Huh?
depends on the which is more mature or not?
Yeah, we are going to study that in your lecture number 3 after introduction
Maybe
to
because,
psychology.
doctor, maybe
Yeah.
you know someone 25, but he's not mature enough. And maybe you can find a person who is 17 and is more mature than 25.
Yes.
Yes.
That's what we call as fixation psychology. We are going to look at that in your 3rd lecture. Okay? You are going to diagnose yourselves eventually, and you are going to discover so many things, no, that are actually happening in your age group. Yeah? So we are going to focus on the whole person. Right? That's one thing that we are going to look into. Okay. So, the role of BPA, American Psychological Associations, to encourage it to system-based curriculum, particularly in advocate for research funding, educational research, particularly for visual learning, no? Liaison to accredit dental association, particularly. You see, here because we have your own hospital, and our hospital, the dental hospital is accredited, no? Isn't it? GCA, right? And of course, you should learn how to love dentistry as such. All right? So this is actually completing the introduction to psychology. Dentistry. Psychology is very useful to dental practitioners because, among others, the most important thing is that it will help you understand who you are and what you are capable of. It will help you understand also your patients. it will actually help you understand the similarities and differences among people. We often compare ourselves to others, right or wrong. Comparison or comparing yourselves to others would always be an exercise in futility. If you're going to do that, there will be no. You will be the loneliest person on earth. You see? If you are going to compare yourself to others, you will be the loneliest person on earth. You should be very happy on what you are and who you are. This is exactly the main point. Why is it that psychology is being taught in first year? Because it will help you understand your, let's say, the problems that you may encounter. It will actually help you understand other people and yourselves, your relationship with other people also. You see, sometimes, human as we are, we always think, he's very lucky. He's always getting 100. Why is it that I don't get 100? I only get 75. Yeah? Why is it that he is A plus student? Why is it that I don't get A plus? I only got B. You see? But if you realize, maybe that person is actually very lonely also, trying to please the parents, because the parents are always pushing him to become, sometimes, raising families like that, raising children is like that. You push your children to be the best of what they can be. And that is also, right? You are lucky if you have B and your parents accept you, isn't it? Your parents would always say, congratulations, you pass. Yeah? They are not asking you to do something more. There are parents like that. And then your parents tell you, okay, did you do your best? When you say yes, but the best is only B plus or B, then congratulations. Your parents are happy. Right? And you are very happy also. Look at how lucky you are. Yet you're comparing yourselves to those people who got A plus. But the reality is that A plus student may actually have some problems at home. The children are pushed to do things to their limit. Have you heard of some students who committed suicide already in Siargao? Some Indians, no? Right? Actually, last year, the grade 12 student jumped just because the parents push him to achieve good grades. Yeah, isn't it? If you're actually reading the news, it happens that way. And they're very unlucky just because you keep on pushing to their limit. And that's not actually very good. So this is the thing. If you learn to accept who you are or what you are, then that will be very good. Right? Very good. Do not actually try to do something extra when you are not, or when you cannot. After all, you can become dentist even if your marks will be C. Right or wrong? And when you're going to become a dentist, no one will actually ask you, what is your grade in surgery? What is your grade in oral dentistry? Right? No one will actually ask you that. They're going to see and look if you can actually communicate with them and connect with them. How pleasant are you with them, right? If you are very pleasant with them, then they will become your patients, right? So I really would like to start introduction to psychology today. Your lecture number, that is What is Psychology? First chapter of Introduction to Psychology by James Collett. Would you like to start? We still have time, no? Maybe to dismiss you at 3:45, right? For those people who are actually using our school bus. Everybody here who uses our school bus, you leave at 3:45 or 4:30. Other students ask me at 3:45, you know. Anyway, so that's the thing. So that introduced psychology to dental science. I really would like now with our main topic. Okay, so number one, please read chapter 1 of the Introductory Psychology by James Calat, and discuss with you right now what is psychology. No, so it's very important. Any questions so far? All right, I will open. I already uploaded this in the website. You can download anytime you want. Okay. Okay. We have here number 1. On the other side, do you have any questions? You would like to share something?
No, thank you, doctor.
No? Okay. So we start now our main topic. We have here, is it open now?
Doctor, the introduction, is it only for, this PowerPoint?
No, I will ask you also about communication eventually during your examinations. That's the reason
we
why.
should know that. Okay, thank you.
Yeah, we should know what the real purpose. Why is it that we are studying
Are
psychology
we
as
going
such?
to start with the new lesson?
Yeah.
Oh,
Yes.
no, doctor.
I will introduce this to you so that you know what to do. Okay. Yes. I will introduce this to you maybe for 15 minutes. You will be guided on what you are actually going to read. When you read the chapter 1 of your textbook, that will be your official textbook by James Calat. All right. But of course, you can borrow also my book. I have my book here in the library. You can borrow the textbook that I have. The textbook is here, Introductory Psychology for Nursing and Allied Health Sciences. I have also other textbook published by McGraw-Hill, Psychology for Nurses. No, these are all available in the university, so you can actually borrow them. Okay, so let's proceed now. What is psychology, right? So most of the time, wondering what psychology is. No, it looks like it's like enigmatic. No, something like when you hear the word psychology, it's something strange. No, what is psychology to you? Actually, psychology originated from philosophical studies. No, when people philosophize things, when people try to explain some things that are happening in the environment, including paranormal activities, ghosts and other spirits. No? So let's start from psychology. No? And let's understand that wisdom as a science. No? Psychology comes from the root word psyche, meaning your soul. So something like intangible, something we cannot see. How can we study things that we cannot see? Well, remember that in science, we only study things that we can actually see. We can actually prove their existence. Sir, you may actually ask me, why is it that we are also studying in physics things that do not exist? We're trying to find their existence, like in the case of our elementary particles, no? Things that cannot be seen, but yet discovered to be there, right? Some of the elementary particles that are actually discovered very tiny are called bosons, isn't it? These are small particles that exist in millions of a second only. What about the psyche? What about the soul? Can you study soul? Can you study things? Can you see your own soul? Yeah. No. Now, this is actually the beauty of psychology because we found a way to study the soul. How do we do that? By looking into the manifestation of your soul. And what's that? Looking at all your actions. You move. What dictates your movement? What dictates your action? Your human soul. So that is actually the beauty of psychology. We indirectly study human soul by looking at the behavior of an individual. You see? So, definition of psychology, psychology is defined as a science that deals with the study of human behavior, indirectly telling studying the soul because the behavior is dictated upon by the soul that we have. What we think, you can see what you think, go into your mind. I cannot go into your brain, but I can see your action. Isn't it? When you are smiling, I know that you're happy. Soul is happy. I can see your attitude. I can see your movement. I can see your facial expression. When I see that you're sad, I know that there's something with your soul. I know that there's something on that's going on in your brain also. So this is the thing. By way of studying the behavior, we study the soul. There's, when you say psyche is the human soul, we study the human soul, we study the behavior, we study the soul indirectly. So that's exactly what we need to have, what we need to do, no? So psychology is the systematic study of behavior. Behavior are things that can be seen. And of course, our human experiences. Now, there is a psychology, a branch of psychology that is established because of our human experiences. That's called phenomenology and existential psychology. But anyway, we are going to look into that as we go on. The thing is, I really would like to emphasize behavior. This is the thing that we would like to see. This is the thing that we would like to observe. Psychologists observe your actions. You know, we assess psychological health by trying to give you examination. When we give you tests, we observe your movements, we observe your stroke. Have you medical tests? It should be one by one. We are going to observe your choice of colors. We're going to observe what you're going to draw per. You see, there are so many techniques. Like for instance, I'm going to study you really if you are some sort of angry with your parents, or you have tension with your parents. We're going to ask you to draw a house, a tree, and a person. We call that as a house, tree, person. As you do that, you observe how and what you're going to draw first. Are you going to draw first a house? Are you going to draw first a... As you draw, we are observing also the stroke. Is it very hard or is it very... See? Is it straight or not straight? Yes. There are so many interpretations in that. It depends on the totality of what you have. Maybe you really love your house. You really love your family. But of course, it depends. If you are going to draw a house, it's hard. Maybe you hate your family and you do not want to go to that particular house. In that case, there could be something wrong. There could be a problem, and the psychologist will look deeper. What could have caused that anger? What could have caused that problem? So we are going to conduct a series of tests already. You get it? This is what we actually do. We look behavior to look what is inside your mind, to look what is inside your soul. All right? So basically, that's studying in psychology. That we are trying to transfer to you. I'm trying to let you understand it. That's the way of understanding people. Because if you're going to observe the behavior, you know what they're thinking, isn't it? You know when to stop annoying them, when you to stop, or when you start something like playing with them. Something like that, no? All right. So we study psychology in order to understand, explain, and predict human behavior, just like you questioned a while ago. What is actually the use of this? How do you interpret? Number one, we study psychology because we would like to understand people, including us, because we are a part of that people. We would like to understand the behavior of people, including our own behavior. Isn't it? All right? We would like also to explain our own behavior and the behavior of others. You look at this. Why is it that you are always telling to other people why he's acting so strange? Why is he acting? Most of the time, the point of comparison is our point of view. Most of the time, the point of standard is our standard. We have to look at other people based on the standard that we establish. He's good because he's like me. He's not because he's not like me. You get the point? We look at the standard based on the standard that we have to look, that we have established. That's the reason why there is misunderstanding. But if you're going to look on the standard of other people, if you're going to explain the behavior of other people, you can actually understand them. And you can live with them properly without quarrel. You are going to live with them with peace. Isn't it? If you can explain why is it that they are acting that way. And of course, other than that, we will predict their behavior. We know when they are going to become, let's say, distracted. There are so many things that we can actually apply. Number one, in psychology, criminal behaviors. We know for a fact that these criminals do have some sort of antisocial personality disorder. Why they hate people? Why they hate people? Because they kill people, isn't it? Criminals steal from other people, right? When you're a criminal, that means to say you are violating the norms. You're violating what is actually the rules that are based in the society. When you violate that, you hate those people who establish those. You could even kill. You could even get the properties of other people. Why? If you're going to look at that and dig deeper, maybe when they were young, there were problems. When they were young, they were so influenced by people around them. That's exactly what we are going to introduce when we tackle human development already. Stage by stage, we are going to study people as we go. Yeah, we're going to look at what is supposed to be the one that can be achieved on specific stages. Very simple things. No, sometimes that we commit may destroy a person, isn't it? When you were young and your parents tell to you, maybe not thought about, they will tell only once, and you are going to be told back, you are stupid. What happens? See, it will stick. Do you understand what I mean? That simple thing that you have mentioned once that you have not thought about could have destroyed that person, isn't it? It will be there. It will be a part of who you are. That's the reason why you have to be very careful in dealing with small children. You see? So that's exactly the point. We are going to study psychology because we would like to explain, understand, and predict human behavior so that we can actually prevent of distraction around us. We know when to stop. We know when to arrest people. We know when to hit other people. We know when to arrest other people. We know when to help other people. You see? People who are actually crying out loud as if they would like to commit suicide already, we need to help them. The moment that we cannot help them, they can kill themselves. Very destructive. And often it actually happens. We could have helped them, but unfortunately, we fail to recognize the cry for help. Now, I always tell my wife, you see the friend of my son, it could be a problem. You see? You are actually having Facebook. The best way to understand people and look at the people is looking at the posting on the Facebook. The quarrel with other people is a good thing also, because that's a sort of displacement, unburdening themselves. But the problem is the whole world knows. Isn't it? Especially your friends will know, right? I hate my life. They will draw blood and tears. Maybe this person is actually living some sort of towards out. You will actually be there over. You will not ask, what's your problem? Maybe you will just take to that person, and that person will share. You get the point? So what's up with your friends in the Facebook? Huh? You look at the posting, you will know, no? So as a psychology student, you will actually realize this as we go on. You will understand their posting. This is so many things about this. How to interpret their posting, how to interpret what they are actually
Doctor,
feeling. Yeah.
may you please come closer to the laptop so we can hear you clearly?
Yeah. Okay, I feel so bored. That's the reason why I have to walk around. Okay.
Okay. It's okay.
Okay, I need also to have circulation on my foot, no? Because standing is
So the
very
blood can
difficult. I
move.
have to move around. Yeah. Anyway, so I think I am through with my promise. I'm going to dismiss your 345. For those who are on the other line, will you please type your ID number, 2 digits last, and say
Okay.
present. Okay? Then you're good to go. But for those who are here, I'm going to check your attendance, please.
Okay.
Then you're good to go. Okay? So on the other class, once that you have typed your present and your ID number, last 2 digits, you're good to go. All right.
Doctor,
Yes, my dear.
I am Huda and I was supposed to be on site today, but my sister was sick, so she couldn't drive to the university. So both of us couldn't.
Please try
But we
to
both
message me her ID number.
53 and 52.
Yes.
I'll just write present then. Thank you.
Huda, huh? All right. Please download the textbook. It's the latest, 2017. You can download at home, laptop, and your iPad. Okay, you're group 2 now, B2, right? Okay.
Mona and Huda, yes, B2.
Yeah. Where is Nuha? I would like to see you. Indian. Okay. Oh, I really would like to see, no? Muhammad. Muhammad, where are you from? What school? High school. Muhammad Hussain. You are? You are this person? Yes. Okay. Hussein. Mansoor. All right. Shaima. Shaima, local. All right. Lana. Okay. You have a namesake. I like her video. Lana Rose. Yeah. You know her in the Facebook, no? Oh, she is a rich little lady, no? Abdullah Yassin. Walid, I received your email yesterday, no? You emailed me yesterday. Alina. Nancy. And which Nancy Fadi? Let me see. Syria? No. Huh? Okay. Paula. Huda. Abdul without A. Abdul Rahman. You're not here. Khalid. Size of pizza. If you are not Bangladeshi, you should be Pakistan. Half. Okay. Omar. Mariam. Noura. Muhammad. Very common. Local, no? Noura. I have so many students. Abdullah. Muhammad. My first time to encounter this name. Trajbi. Trajba. You don't belong to which nationality are you? Bahrain. Oh, okay. So many Bahraini students coming from here, no? Muhammad, Bib, Ahmad, Amir, right? Muna, Mona.
It's
She was online.
represent.
Okay, you're online. Huda also, right? 53?
Yes, doctor.
Yes.
All right. Wed? Oh,
Dr.
very
Nuran.
nice name. Like Wednesday or newlywed. All right. Bahini? Anybody? Okay. Nuran?
Yes, doctor, I'm here online. I
Oh,
couldn't
you're
come to the
online.
university
Why you are joining online? You're supposed to be here?
because I have
So
some
what?
transportation issues.
Okay. So what? All right. Any name? Anybody else not called? No, I'm expecting you to read, no? This is the only way to learn. Read and read and read. You have the textbook, I chapter 1. Okay? With that, we're good to go. Thank you very much and nice meeting all of you. Ladies on the other side and gentlemen, good morning and good afternoon. Have a good day.
Doctor, please don't forget to send the recording.
Yeah? What's
Don't
that?
forget to send the recording.
Yes.
Doctor,
Yes.
Muhammad Sayed.
Muhammad Sayed, what about her? What about him?